My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to Operate with Zen. Today, I have the great pleasure of being joined by Dr. Sima Porten. Sima, introduce yourself to the audience.
Hi, my name is Sima Porten. I am an associate professor at UCSF, and I'm a urologic oncologist. I primarily specialized in treating patients with urothelial cancer. I'm a mom of two awesome kids. What else about me? I like to dance. So I used to be a dancer. I'm retired now. And I'm really happy to be here with you today.
Well, thanks, Sima. Sima and I have become really good friends, I would say, over the last few years through the oncology circles. But now we've even started a tradition of meeting for yoga classes at meetings and spending some time together away from the meeting to kind of work on our mindful approach to life and being urologic oncologists. So it's one of our newer connections.
Yes, and it's been really fun. And anybody listening, if you ever want to join us, shoot either of us a text or a DM. Is that my residents correct my lingo all the time? And we'd be happy to have you join us anytime.
Absolutely, and we're even batting around the idea of starting kind of an open call yoga class at one of these meetings where we can bring some instructors in for people who are a little nervous about going to a studio or doing that. We'll try and maybe we can bring it to them.
Sounds great.
Well, both of us bring mindfulness into our lives and into our practice. And just wanted to start with you, Sima. Tell us, how does mindfulness fit into your life and practice as a urologist?
Yeah, so it didn't always. So growing up, also as first generation Indian, my parents sent me to what we used to call Indian school, which is basically like learning about Hinduism as a religion. And you had to go every Saturday for like 4 hours. And it was really not anything my brother and I looked forward to, because part of it was like this enforced meditation that they would try to teach you. But, you know, as a kid, it's really hard to sort of get that concept of trying to be still and be like Zen, or however you want to put it, right? It doesn't really, it doesn't sort of jive with kind of how life is going, at least at that time. And so either I'd fall asleep or I would be very incredibly bored. And so from that experience, I more was the one that if you're moving and shaking, you're moving forward, right? So I tend to have a lot of energy anyway, so I like to do that, and that is my tendency. And so you kind of push at things and put in full effort, and you're really busy, and then you see success, and then you just keep going, and you keep going and going and going. But it's fine when the asks of you are small, because you're a kid, right? But as you move through life, if you keep going that way, your life gets busier and busier, and the asks get more and more. And you keep hustling and hustling and hustling. And then all of a sudden you end up thinking, what happened? Like, what happened today? I actually don't know. I can't remember who I talked to. I don't know what I did. And I don't know if anything that was done that day had any purpose. And so I think it was through kind of that learning experience, and particularly in residency, and then becoming a parent in residency, where that becomes just a lot more in your face, right? And so it was around that time that I started thinking about, well, I don't want to keep hustling through everything and miss all the good stuff. I think even at work, at home, in doing the things that I thought were fun, it became a lot about, like, when you're an intern and you make the checklist, just checking off all of the list. And at the end of the day, the list was done. So that was good. But again, like, could I get you a memory or a feeling of the day? No, probably could not. And I think becoming a parent sort of made it very real to me that that's not really how I wanted to go about life. And so that's when my version of mindfulness kind of ended up coming into being, not super formally, and I don't think I had a term for it, but for me, it started with trying to be more present, right? And so when you talk about mindfulness, I think one of my favorite um, interpretations or explanations of it is it's making a conscious choice about responding to things around you, even when that is beyond your control. So you can't control how many times you get paged. You can't control people, your kids repetitively saying mommy or daddy or whatever. There's a lot in your life you can't control, but you can control your thoughts around it and how you respond to it, right? So if your family member, friend, child is sort of asking for your attention, you can control how you focus that attention on them, and you enjoy that moment because you've chosen to be there for it. You can control how present you are when you talk to a patient and you try to form a connection. The operating room is probably one of the greatest places for mindfulness because you only have one goal, right? Take care of the patient. So you can take all of those thoughts of the grocery list running through your head, of some annoying interaction you had earlier in the day from X, Y, and Z, and this thing happening here and that thing happening there. You can control and ignore it because you do have only one goal or focus, maybe two, if you have a resident in the operating room and you're teaching them. And so from that, I think that probably is my best analogy in terms of how you can think about mindfulness and how it can be really important in creating a really happy life, where at the end of the day, you could easily tell yourself the like 5 awesome memories and things that you've enjoyed, right? And that's the other important part of it, is that you got to try to do it every day, practice. Anything that you want to be good at, you got to build as a routine and practice. It's got to have some kind of positivity to it. Life is not all sunshine and flowers, but there are always rainbows after the rain. You can always find something to be grateful for, appreciate. And your thoughts, the stories you tell yourself, I guess like the fancy word is thought distortions or negative kind of things. You do have the control to figure out where that comes from and how to change it. And that's how you can kind of move through life in a very intentional way and like have a lot of joy and not feel like you're always giving something up to do something else. And I think that's probably the biggest thing I try to teach residents, because probably one of the biggest questions I get is how do you balance your time, which I think is also the most nonsense way of thinking of life.
Yeah. Wow. I love 27 things you said, but we got to start somewhere there. One of the first things you said is you didn't start in a mindful practice, and you didn't even necessarily start intentionally mindful. And I think a lot of us now who incorporate mindfulness into our daily lives realize we were doing things that were mindful over the years, and being more thoughtful about it has not only teaches you new things, but it affirms some of the things that you were doing well. So, so for kind of people who are new to this concept or trying to think about ways to incorporate mindfulness into their life, what are some of the things you think they may be doing well now, and some of the ways they can improve to make those little steps, to make those little routines that you may have seen in your practice?
So I would say the first is sort of looking at being really honest with yourself and know what kind of person you are, right? I don't think I'm ever going to be capable of just sitting there and quote being mindful. Um, I need to have some sort of physical activity to be able to do that, right? So yoga is great. I like it because you're moving, but yet it's not to the intensity that sometimes I think Peloton is. That where all I can think of is just breathe so you don't pass out and fall off this bike, right? There's enough of challenge, but I'm better able to concentrate, I think. So I need some sort of movement or activity. It's partially why I think the operating room is great, because you're doing a task that you've practiced a lot, and you need some focus, and there is some activity and moving around. I actually probably get distracted the most during robotic cases, and so a small thing I've done is move my phone away from the console so I could be a lot more focused and mindful, because the phone is an incredible distractor for me. And so it's partially why I enjoy open surgery so much. I can like walk around and wander and, interact with the resident or fellow. So that's why I like it. And so I think understanding yourself and what you need to sort of be present is important. So for me, I need some activity that is not too intense and not too boring, basically. is my like happy spot on where I can pick a time to be really intentional and be present. And so with the kids, it's usually like I like playing board games or doing something outside. Always have to put my phone away, because again, for me, that's my that's my kryptonite, right? That it will distract me. And so it's accepting that and knowing that, and then doing the things I need to do to make myself successful. So those are things that I know about myself. There are some folks who, to have a mindful practice, it's the morning time and the quiet, and they really need that stillness to think about things in the morning and the evening. That will never be me. And so I think from that aspect, those are some things you can look at and make small changes toward. I would say if you just start with the trying to be present. So when you're at work, try to be as present as you can. When you're teaching a resident, same thing. When you're at home with your kids, same thing. And so if you start with those strategies, I think the rest kind of comes naturally, and then you get interested in it. So you read more about it on, well, what are some other things I can do? And then you can kind of build on that. I think most people do that to some degree. And the hardest part, I think, for folks is to make that choice, because I think we're conditioned to try to multitask. And so it's about trying to break yourself away from that habit.
Yeah, it's really great advice, just to kind of, give little summaries. So first of all, multitasking is a complete misnomer. There's actually scientifically proven about 2% of the population can actually effectively multitask. So even if you think you can, you're probably not in that 2%. Very few people can actually do multiple things at once. We're often rapidly serial tasking. And because we're highly productive physicians and professionals, because we've done so well for so long, we can do that effectively, but that's not really being present, and it's incredibly inefficient. Rather than just devoting 5 or 10 minutes to a simple task, we'll spread it out over the course of 2 hours because we're doing 7 other things. So that's a great piece of advice. I love your advice about boundaries, right? And knowing who you are. So for you, a big boundary is the cell phone. right? That's a really big one. I'll tell you, at home, I'm less cell phone dependent. I kind of unplug immediately once I get home. But you're right, in the operating room, huge distraction for me. So I'm going to take your advice and get my cell phone away from myself in robotic cases. I think it may help me be a better teacher. I think that's really important. And I really like how you said, not only knowing yourself so you can pick out kind of your mindfulness strategies, but there are lots of mindfulness strategies, right? I mean, there's literally books full of them, but in the simplest forms, there's kind of passive mindfulness strategies where you kind of sit down and meditate and do these things, or there's active, meaning during a walk or during exercise or during an operating room. People, it's one of the great analogies is people who do high intensity active sports, mountain climbing, anything that's risky or life threatening. They're doing it to get in a state of presence where they're solely focused on not dying while they're climbing that mountain or that cliff or whatever they may be doing, that they're totally focused and present in the moment. So there are ways to passively engage mindfulness and ways to actively engage mindfulness. And you got to find the right balance.
And I think some of it's just having a couple tools just based on how you're kind of doing that day, right? Sometimes like you're just over it, you're tired. So that's when I will do more of a listening thing. So it's termed guided imagery, right? So it's someone talking at you, and you just got to find the person that doesn't annoy you in that aspect, right? Because there's a bunch of them out there, and some of them are incredibly like, I'm all into this, and I'm not okay with whatever's going on. But I do have some go-tos that you can sort of listen to get you in the right mindset. A lot of people do this naturally when they play their favorite music, right? The music that makes them happy. That's actually can be a guided imagery strategy in a way, not technically, but it's a way of knowing how to regulate how you are feeling and knowing that you can change that, right? I tell my kids that all the time. I was like, you do not seem to be in a good place. You need to take some time, go do something that will make you happy. Well, then you get the point. Nothing makes me happy. Everything sucks. It's all terrible. The world's going to end. Nothing will make me happy except some completely off the wall, unattainable something that they'll come up with. And so the thing is working through that, like that's from a kid's perspective, but from adult perspective, you can end up in that same place easily, based on how hectic or busy or stressful a day is, right? And so it's just having your key go-tos on how you get yourself out of that. And so for my daughter, it is music. That's what kind of helps her. She sort of gets in her groove. She can fix her mindset and then kind of move onward. For my son, it is athletic activity. So he just needs to get off the screen and go outside, and then it will fix itself. And so, but everybody has a different one. If the traditional guided imagery ones generally tend to have a theme or a point. And so from that aspect, we actually use that for patients in terms of managing anxiety prior to like cancer surgery. And so this is where we did a clinical trial randomizing patients to a guided imagery intervention compared to not, and assessed their anxiety. And this is only with 2-week kind of intervention, assess their anxiety the right before surgery, the day prior to surgery, when someone was supposed to be the most anxious. And we had clinically significant reductions in anxiety. The guided imagery recording that was provided to them was focused on, was set up for the things that make people anxious about having a big operation, and particularly a cancer operation. So it was done for our cancer patients. And so it was about trusting your team no matter what happens, even if it's hard, even if there's complications. It's about visualizing improvement in terms of your function or quality of life. It's about empowering patients to be strong enough, even if the outcomes aren't what they wanted. And it's also about visualizing your cancer being dealt with. And so those are the themes of this imagery. And so that's a very targeted thing, right? If you always tell, like, so for a patient, that's one very targeted guided imagery. For like us as physicians or trainees or etc., you kind of have to know your downers, right? What those are. And then generally, then you can seek out these targeted guided imagery things meant to bring you out of that kind of state. And so they have it a little bit, they have them in those little self-select things on like apps like Headspace and that, about I'm based on how you feel, you kind of look for a I guess it's like an affirmation or a meditation to kind of help you move out of that space if you don't feel like you're in a place to be able to do it yourself. So I think there's a lot of these different strategies that can be used across the board.
Yeah, really cool, Sima. And you know, I'm totally on board. So but critics will say, right, people that are going to respond well to this are, it's because they, you know, it's because of who they are, because they like this, and that not everyone is necessarily going to respond to these things. Now, I know you did a randomized, I know it's randomized, but kind of tell us your thoughts on that. And is this going to work for everybody? Does it require buy-in? You know, how much of this is, you know, kind of biophysical and how much is kind of voluntary?
Yeah. So although, you know, we had that randomization, right? We did look at the baseline characteristics of our population here in San Francisco, right? And so that's a limitation of our study, that about 30% of patients, whether in both groups, were knew what mindfulness practice was and had engaged in something that we classified as a mindfulness based practice in the past, right? There were about 10 to 15% of patients on anti-anxiety medication already. So it was, you see a little bit of difference in terms of demographics in the group. Not everybody who was randomized to it loved it. Some people said, well, it's okay, but really for me, it what I would choose is my church support group as my way of reducing anxiety. And when you ask them, well, why you choose that? Oh, well, they tell me the same things, but it's from a person that I actually respect and care about than some random who's talking at me over this recording you gave me, right? And so I would say that even with those criticisms, that they are completely valid, right? But that even folks who this was not their jam, essentially, right? In listening to this, they could provide you something else that could be used in lieu of it, if that makes sense, right? And so if you ask them, well, why did you hate it? Everybody came up with something very similar to what the one patient story that I shared with you was. And I thought that was pretty powerful. And this is the part where you start with, well, in the end, it's about being intentional and present. And there's not one right way to do it. This is putting a lot of fancy words to tools that people have used for many, many, many ages, but that as society has changed and developed, we've kind of got more distant from a lot of those things that used to provide the same support, right? Community, for some people it's religion, right? So, and I think that's just this is a bigger thing, like a change in our society in general. And so I think that's why this has become so popular, because not everybody can come up with something to replace this. And so I think that is usually my response to that criticism, because it's definitely fair. But I would say that if you have an open mind, there are parts of this that could speak to almost everybody. You just got to figure out what it is for that person.
Yeah, I think it's a theme running through our conversation already is kind of, being an individual and finding what works for you. But I just want to highlight two things that you said. First about religion. At its essence, the majority of religions and philosophical experiences are about being present. They're about being mindful, and you get at it from a different tradition and from a different way, and there's a different story. But in general, they're about being simplistic, about being minimalist and essential, and really focusing on what's important in your life and being present. And I think that's an important thing to let people know that your religious faith is amazing. Let's run with that. And that will help give you strength and be mindful and present and do the things you need to do to kind of be successful. And the other thing I was going to point out is, your your study is founded in science. I mean, there's tons of science here that people don't appreciate about mindfulness and how it actually improves a number of measurable, objective physiologic parameters: immune function, cellular inflammation, decreased pain, anxiety, depression, overall happiness, and kind of other scores. It improves memory, creativity, abstract thinking. These are things that are well documented in scientific literature, not just soft sciences. This is well documented. And if there's anybody out there who's interested, every once in a while, now that we have a YouTube channel, I'll hold up a book for people. This is a great one: Altered Traits, for the skeptics and the scientists out there. The authors are Daniel Goleman and Richard Davidson, and it goes into the science of mindfulness and how you can actually change. It shows you the science between cellular inflammation. It shows you the genetics and the epigenetics, and how actually mindfulness can be passed on, or the traits that come along with mindfulness can be passed on from generation to generation. Just as people who have tough stress reactions can pass those on to their children, those who are more mindful and present can pass those on to their children. And so you really can make tremendous benefits by doing this.
Yeah, I agree. And I don't think I've read that book, so I'm
It's a
gonna
little dense, but it's a
have
good
to
one,
check
and
it
it
out.
really has a bunch of the science in there. One of the other things that we've been talking to is finding the things that work for you as an individual. And I think one of my personal benefits to being more mindful is I'm better to assess my situation on a minute to minute, day to day basis. Like you said, what do I need at the moment that will make me more present, or make me happier, or make me better? And listen, it's not all puppy dogs and rainbows every minute of the day. That's part of life. But kind of understanding the situation, understanding how you can get out of it and move on to the next step, that things are going to get better, I think are one of the real advantages. And I think the other part of recognizing that is there are lots of mindfulness practices, and you can tailor them to what you need. So my practice right now, the way it currently runs, but it's always evolving. In the morning, I do brief yoga to kind of loosen up my body, and I actually do a guided meditation in the morning, because I'm anxious before I go to the operating room and before I see patients. So I can't just sit there. If I just sit there in silence, or my mind will go, and it's basically ineffective time. So I need something guided in the morning. I try and do another mindfulness actually period or episode before I go to bed. And that one is a lot more silence and introspective and not guided. And that's kind of what I need before I go to bed. And it helps me kind of wind down and kind of let the day pass on. So there's lots of ways to do it. And the last thing I'll say is, listen, when you go to the gym or you work out, you don't just do bicep curls. Right? If you do lots of exercises, you work your body out in different ways to be stronger and more fit. So there's lots of ways to approach mindfulness to kind of get the benefits in different areas.
Yeah, I totally agree. And it's about, another thing that people will say is that it's just life's too busy. I don't think I can do it because it's too busy. So the other part is how to practically work it in. You found a good routine. For me, the more quiet one is when I walk home. I'm lucky enough to live pretty close to work, and so it's when I walk home, that's when I sort of do my kind of practice. Mornings are harder for me. I kind of want to just get at it and go. Also, it's like I got to making lunches, getting all the stuff together. Like that is, it is the time where I just allow myself to like go through my checklist. And so from that aspect, I do that. The other time I really try to incorporate mindfulness is actually, I know myself, I get a lot of joy from being around other people, right? And I draw energy from being around other people. That's just a thing about me, and I know that. So when I see patients, like I try to really be present and listen, and I end up feeling a lot less rushed. And you'd be amazed how just a couple questions don't take long, just a couple minutes, and you can learn a lot about somebody. And it's fun. It makes the experience like more happy, more joyful. And so the question I use in general when I talk to patients is I ask them, oh, like, so what are you into? Like, what really brings you joy? I learned it from our integrative medicine doctors, and I heard them asking that one time. I'm like, that's kind of a funny question. What do people say to that? Turns out they say all kinds of stuff, and you actually learn a couple really interesting things about the person you're taking care of. And for me, that is one way I try to be present and grateful. And you end up not having those thoughts running through your head like, I got 30 minutes and I got a document and I got to go to the next one, and this person's paging me, and then all this is happening, and this other, like the nurse is coming to me, like some disaster is going on. It takes a lot of that out, and it makes my clinic day, or half clinic day, just a lot more enjoyable and less stressful.
Yeah, that's a great piece of advice. I wrote that one down, put big circles and stars over that. What are you into? I'm going to try that one in clinic. I often, I mean, listen, we see a lot of patients, and sometimes it's follow up, and it's like, great, your cancer's gone, you're doing great, right? That honestly, that conversation could take 15 seconds, but that's not why that patient came. I mean, yes, they came to get the news, but they came to see you and talk about life. And so, I always try and ask about children, ask about work, ask about life, because that really is that connection that brings people to it and draws you into the presence of being in that moment with them, sharing that moment of the joy of the success of cancer being gone, or listen, God forbid, it's cancer's back. We have to deal with this. It also makes you more present and really connect with those people. And I think it's one of the joys of medicine is connecting with people, as you bring up.
Yeah, agree.
Yeah, one of the criticisms I get of this podcast and these conversations, and what people really struggle with, is that one question you brought up: how do you find time for this? And I just want to make it clear, when I'm doing mindfulness, sometimes this is 5 minutes. I mean, at most, maybe 10 or 15. I'm not talking about hours in a day. My life wouldn't function. So just kind of, put in perspective, give people just a little understanding. How can you get started? How do you prioritize these things? What's the time commitment, so people can understand?
Yeah, I think it is a minutes. It's measured in minutes, really. And so again, it's sort of looking at your schedule in life and saying, okay, when can I do something at the same time every day? It's the same way of trying to figure out how do you work in exercise or any of the other things that you want to kind of build a habit for. And so start with a small ask of yourself. And once you get a win, and you feel better, it will build on itself. And then you can add in more minutes where it seems reasonable. This is not hours. I don't do an hour yoga every morning before. There's no way I couldn't wake up early enough. It's not practical, right? Like and I don't do that and sit there being mindful. It's like working it into my walk home. Sometimes I'll listen to guided imagery. Sometimes I'll just, do my thing as I'm walking. And it is about building it into, I will be fully present for one interaction, this X interaction a day, and not be distracted by something else. I will make sure that one time during the day, if something goes through my head that is more of a negative thought, I will take the 2 seconds to think about where that came from and try to instead come up with something positive. So it's like those small wins measured in minutes, not hours, because no one has hours.
Yeah, I hear you. And one of the other things I always like to say is, we have a foundation. You've heard of Maslow's hierarchy of principles, right? Where we kind of have these base needs, or a hierarchy of needs. So we have these base needs, and as we climb up the pyramid or the ladder, it gets to self-actualization. At the base of our pyramid as surgeons and physicians is really our well-being, and that's physical health, it's mental health, it's all of those things. And everything above that becomes easier. You'll find yourself unlocking more time and more abilities to tackle your clinical practice, your interactions with colleagues and patients, your time in the operating room. It all gets easier to manage if you've got a good foundation. And it's not a major investment. It's a little bit of time here and there can pay huge dividends.
Yeah, I completely agree with that. It's just a little bit.
Yeah, there's another author named Chris Bailey, and he has I think it's just an audio book called How to Train Your Mind. But he basically he's from a business background, and he quantifies it, and he says 1 minute of mindfulness will actually buy you 9 minutes of efficiency throughout your day. And so you can imagine with just if you use that calculation, 5 minutes of mindfulness, 45 minutes of extra time, you could get a lot done in 45 minutes if you had that extra time in your day. So start small, and that's the advice I give people too. It's not a huge investment. Building the routine is a little bit more challenging.
Correct. You gotta see what works. What works for you or me will not work for someone else. And the really annoying thing is what worked for you 10 years ago may not work for you kind of now. So you got to sort of reassess every few years, because your time in life changes, because things just change. That's like the one guarantee in life, except for birth and death. It's going to change, which I dislike. I hate change. But I learned to be okay with it.
Absolutely. So we're both pretty into yoga, or at least have it part of our normal routine. Tell people about your routine and kind of where you started with yoga practice and the benefits you see now as a surgeon.
So for me, it was brought in more from dance for flexibility, right? As something to kind of do to keep strength and flexibility. So it was more because my dance teacher made us do it, because she had a very strict kind of whole thing, and that's how her goal was that we won every competition. That was the undefeated title was her kind of thing. And so from that, I learned a lot of yoga, and I was like, that's actually nice, something I can do. I had a few knee injuries. One was actually in a performance, and one was possibly maybe wrestling another one of our colleagues in urology at a bar in Chicago in a giant sumo suit. So that's where the other ACL went down. And after those, kind of building back strength and flexibility, yoga was something I could do, because running was hard, as was other things, until I got strength back. So that's how it kind of really got me into a practice. And it's the other part of that is it's something that it seems like you can do for a very long period of time, kind of like tennis, swimming, those types of activities. There's no way I can be on point shoes for now. I don't know if it'd be even possible if I put them on, if I could continue to do those kinds of activities as I get older, because you change and what you can do changes. And so that's how I kind of got into it. And then I realized, this is great. It is flexibility, strength. It's challenging enough, but it is a time where I can make double use of it and practice some mindfulness and be very present and focused and breathe and all those other things that people say are good for you. And then as you start doing it more and you realize, I actually feel great when I do this. Like I was saying, it's like a self-fulfilling prophecy. You end up figuring out a way to make it work. So I would say I aim for me, what's reasonable is 2 to 3 times a week. And I don't like set goals of like, I need to do it for an hour. I'll usually pick like a goal of like 20 minutes. And that it keeps me happy. It seems to be enough. Every now and then I'll do something longer or crazier, or go to a class. But most of the time, particularly now with all these videos, just you're able to like access it almost anywhere. And so that's how that's kind of built in. Yeah.
Yeah. So another similarity, Sima, that you didn't know we shared. I was also injured in a sumo suit wrestling a friend. I chipped a tooth a while ago, and yeah. So there's another thing we have in common that we didn't know about.
There you go.
Yeah. Yeah. I share a very similar story with yoga. I started it for flexibility, and I actually really enjoyed it in medical school. And I got away from it through residency and other stuff. And then COVID hit and I had a lot of spare time on my hands. I said, well, what's one good thing I could do for myself? Well, I need to improve my flexibility. Let me start doing yoga. And then everybody starts for a similar reason, right? It's flexibility. And then you get all the other benefits. And like you said, it's strength, particularly core strength, which is huge for surgeons, I think. The other thing I find really helps is body awareness, right? I know it's helped me identify when I'm ergonomically not sound in the operating room, when I'm pulling on something and something's starting to hurt. And I go, oh, if I keep doing this for the next 2 hours, this is really going to be a problem tomorrow. Yeah. And like you said, and then comes all the mindfulness aspects of it, the ability to be present, the ability to be focused, the ability to work on breathing was huge for me. I ran for years and I was an awful breather. I always felt like it held me back running. And it finally, I honestly, maybe in the last year, I feel like I've learned how to breathe properly through exercise. And it was yoga that taught me that, even though I've been lifting weights and running for the past 20 plus years of my life. I mean, this is what actually got me over the hump of doing that properly. So I think there are tremendous benefits to yoga. Is it for everybody? No, I think we would all admit that, but it does check off a lot of the boxes of what we want in the operating room, I think, from a physical well-being standpoint.
Yeah, I agree. It's also something you can do with, it can be like social. So Kirsten and I used to go to the place like down the street from the hospital. Whenever, we get bent out of shape because anesthesia would unnecessarily cancel our cases at the same time. And you'd be sitting there stewing and we'd say, okay, let's go do something positive and, kind of go down the street. We've started the thing at meetings about trying to find something that's maybe not late night, which is also super fun in terms of socializing, forming connections and bonds and networking. It lets us do something like a different time of the day and like a shared activity, something fun to do, a new experience. And so there's a lot of good things that kind of surround yoga, but you're right, it's not for everyone. And so there's definitely like a lot of my friends too are like, I don't know, it's not for me. I'm like, oh, that's okay. It doesn't have to be for you.
True. Although I tell you, I got my dad to come to a yoga class. My dad's almost 70 years old, never done yoga in his life. And he was in town visiting and we're going to go out to dinner. I said, listen, Tuesday nights, I usually go to yoga. I totally understand if you're not interested, I'll cancel and we'll go out to eat. And he says, you know what? I've always wanted to try it. I would love to do it with you. And you know what? He had a great time and the instructors loved it. People in the class loved it. It was somebody new, somebody who was really trying. And honestly, I give him a lot of credit. He did awesome. He did Rockstar twice. He kind of flipped his dog over. So pretty impressive. So he's very proud of that. And it was a good experience.
Yeah.
I do offer the residents all the time to come. Nobody's taken me up on it yet. I always say I will take you to your first yoga class if you want to try it, and then after that you got to pay for it yourself. But eventually I'll get somebody to sign on.
You're gonna take her.
Yeah,
you'll get to take her.
yeah. Well, good. So this has been an awesome conversation, Sima. I always like to give people the opportunity to bring up things they may want to talk about, cover things we haven't covered that seem important to them and their approach to, either mindfulness or surgery or whatever it is you want to talk about.
I think my final kind of point is that you get one life and you get to choose how to live it. You can choose to live it joyfully, or you can choose not to. And so, I think we've been talking about that we're coming into the age where friends are getting sick and people are sort of facing a lot of life challenges in their kind of own mortality, right? And it reminds you how precious your time is, so you should spend it well, doing the things you love, and trying to create meaningful connections and memories.
I love that message. I think it's incredibly important and powerful for people to hear that. And just to kind of summarize some of the really other amazing things you said today, I think it's important for everybody to remember, nobody starts out being mindful, right? None of us are born with a mindfulness practice. It's not something we're taught as toddlers or infants. So take your time, explore this, realize that there are things that you likely do well already, and kind of being a little more thoughtful and purposeful with a mindfulness practice will help you kind of engage those things and may help you get a little bit more kind of strength out of your own mindfulness practice. You said the OR is one of the greatest places for mindfulness, and I agree with you completely, right? You can be fully present. You can push everything else away and focus wholly on that patient. You can focus wholly on that resident if that's what you're teaching and working on. And it really gives everybody in that room a joint goal and a joint outcome. And I think that's an incredibly powerful statement. We talked a lot about being an individual and recognizing that you're going to have different strengths and weaknesses than others, and you can craft your mindfulness practice to that. We talked about using different types of mindfulness depending on what mood you're in or how you're feeling that day, or what you may need to be in a better state of mind. And lastly, I want to give you kudos for running a trial on patients and exploring this in a scientific way, and bringing this to cancer care and bringing this to cancer patients, because, obviously we're believers, but I think there are a lot of people out there who can benefit from this. And then lastly, we have one life, choose how to live it. Incredibly important message for everyone to hear. So I want to thank you so much, Sima. It's always a pleasure talking to you. I look forward to seeing you in person. Zoom calls are okay, but in person is better. And that'll be shortly, hopefully, at the upcoming AUA meeting.
Thanks so much for having me. And yes, it will be at AUA.
Cool. See you, Sima. Have a great day.
All right. You take care.